Okay, so thank you for coming to this session this morning. I'm Gareth Thomas. I'm the Chief Clinical Information Officer for Salford Royal Group, and I'm also working as a clinical advisor for the Professional Records Standards Board. And I'm here presenting today alongside Helen Fieger, who is Director of Communications and Strategy for the PRSB. And we're going to talk to you today about the vision for the PRSB, give some examples of how the PRSB is standardising care to improve reliability, replicability and safety, and then talk a little bit about the vision for the future. So as the first question is why do we need standards for records? Is this just another unnecessary burden on clinicians and the workforce? Well, I think we need to argue very strongly that this is not the case. What we need to consider is take a step back and say, well, why do we collect data and information within a record? So there are various purposes. Clearly it's for documentation, it's for communication, it's for alerting, it's for standardization, it's for research, and it's for service planning. So there are many, many reasons why we collect data within an electronic patient record out with just recording what's going on with the patient. So my clinical role, I'm a consultant in intensive care medicine and anaesthesia in Salford. So in my clinical perspective, if a patient came in having had a major trauma, what I would want to know is that I knew that patient's history, I knew their allergies, I was aware of what had happened in the base hospital and that the information was collected in a structured way. So I was really clear about the information which related to that patient in a timely fashion, so I felt that I was delivering reliable and safe care. So that's in the acute setting. One of my other CCIO colleagues, a gentleman called David Rogg, he's a multiple sclerosis specialist, and he's got a great vision for what we should be doing across Greater Manchester with standardised records through the use of dashboards and data collection, so he can see across the northwest region how his patients are, how they're performing, and if there's any risk that he should be detecting in real time. So I think with those few examples of a major trauma case, of a long-term condition, and also a reflection on why we use data within an EHR, you can start to see why we're saying at the PRSB clinical standards are essential to drive the safety and quality agenda, and also to support patient co-production of data within an electronic health record. So who are we at the PRSB? So the PRSB is a non-profit making body which is working to standardise health and care records across the system. And the vision, as I've alluded to, is really clear that this is the way to improve quality, safety, visibility of information and data collection across a population. The standardised record template runs all the way from the patient journey, so from referral to inpatient management, handover, to discharge, and to management in the community. And just to give some context, we know that 9 out of 10 discharges to community care settings are done on paper. So when a patient goes to a long-term or intermediate care facility, in 90% of the time we're doing this with paper transactions. So clearly that is a huge risk for patient care, and a real risk that there will be an error made in that environment. So this is really what drives the PRSB with the mission to say, look, we want to be the authoritative voice, the consultative voice who are guiding the implementation and the design of these clinical standards. So on this slide here, we've got a selection of the organisations which we at the PRSB work with. And you can see there are professional organisations, there are technical organisations, and there are also patient and citizen representatives. So as you see there, more than 750,000 frontline clinicians have a direct or a one step away interaction with the PRSB via their professional bodies. We know that on our last standard, 33 different professional bodies were consulted, and the survey was responded to by 1,500 people. So these standards are evidence-based. They've got the buy-in of the frontline leadership and also the buy-in of the professional bodies. So the PRSB are therefore able to demonstrate these are evidence-based, reliable, recognised, validated, standards for collection of data in a standardized format. So just to talk briefly, how do we go about developing a record standard? And you can see the stages outlined on this, this diagram. My personal experience is I've been recently involved in the last 12 months or so around the e-referral standard, which is looking to standardize referrals from primary care into secondary care. So the first thing to say is the PRSB work with leaders to identify a priority area. Stage 2, an expert group is then put together on whom we can pull to get information about what information should be collected within that standard. And then there's a phase 3 here. There is a quite a prolonged process, an iterative process of workshops, literature review and consultation to develop a template for that standard. Next stage is that NHS Digital then creates the technical messaging to support that standard. And it's really important to say that of late the PRSB have been working with Interopen to ensure that we've got FHIR standards and FHIR messaging to ensure that these messages can go in a structured format as the messages goes from primary to secondary care, secondary to community care. So that's quite distinct from the movement of a PDF record or a free text record, which, whilst helpful, is much less useful than if the data had been translated in a structured, readable format. So really important to identify the partnership with FHIR and Interopen. The standard then goes for independent assurance, gets signed off, and then is piloted in a limited number of areas, and then is then curated to ensure that that standard stays relevant over the life and duration of that cycle. So now talk about two specific environments in which the PRSB is working. The first one is transfer of care standards. So the top 4 there, the discharge summary, the emergency care discharge summary, mental health discharge and outpatient letters are all being implemented within 2018. The next 3, as you can see, are ongoing, and the clinical referral information, as I've already alluded to, will be published later on this year to support the removal of paper-based referrals. So that's one big theme of work, the standards for care transfers. The second theme to look at is the standards for integrated care. So it's really clear, we heard Matthew Swindell's talk yesterday about the pressures on health and social care. It's really clear that the burden of chronic disease is going to increase over the coming years. So therefore the ability to collect data and share this in a structured way as patients move through the care journey into the community via a care organisation structure, this is going to be essential to ensure that the right patient is in the right place with the right information. So 2 standards have been published, the Healthy Child Record and the Digital Care and Support Plan, and then to be published later on this year will be the Community Pharmacy and the Maternity Record standard. So quite distinct to the transfers of care, this is about ongoing maintenance of records in a longer term scenario. So just to allude to the Digital Care and Support Plan, I'm now going to show you a short video, Matthew's story. So Matthew, as you will see, is a gentleman who has chronic health needs, and we got a video of his parents saying how valuable to him an integrated digital care record is to make sure he gets reliable, timely care.
So I have to close him up again.
Okay. So one of the things that's really important to think about here is if we're going to implement these or design these standards is the implementation phase. So there's a real issue around culture change and how we demonstrate the need for these standards and how we engage frontline professionals with the need to pull in these standards. So how are we doing this? Well, we already described engage professionals, frontline leaders, engage their professional bodies. Support frontline implementation by talking to frontline clinicians and understanding what their patients and citizens need. Aligning system levers and incentives is really, really important. One of the things that we're working on within the GDE program is blueprinting, and one of the things we've said within the blueprinting program is if the blueprinting program doesn't align with key stakeholders, then it's likely that the implementation will be less than successful. And it's exactly the same with standardized records that the PRSB are developing. It needs to be aligned with what the patients and the system needs such that information can support standardized data collection. We need to build this ability into education and training. So Rachel and I yesterday were on a panel talking about the Digital Health Academy and careers in clinical informatics. So it's important that at the very outset of digital education we're saying to our clinicians and carers, how do we build in the need and the appreciation for standardized data collection to facilitate reliable care, audit, governance and service planning. And finally, of course, we need to raise public awareness, which we do via our stakeholder groups. So essentially, on the bottom bit of the slide there, what this then does is develop standards which are reliable, they're trusted, they will work, they enable staff to work more efficiently, but they also unleash the power of the citizen. So we've seen several presentations today. Aid Byrne was talking about, in the GDE zone, was talking about the ability of patients to upload information around their long-term conditions in Southampton. Without these sort of record standards, that cannot happen. We need to understand where the data is collected and in which format it is. So the PRSB standards support citizen engagement and co-production of health and care data. So another really important reason why these standards should be adopted. It supports change in the power dynamics of health and care, so that the citizen can then own more of that part of the pathway. So that's a little bit about what we've done so far at the PRSB, transfers of care, integrated care, little look into the future. So it's clear that we're starting to shift to much bigger of systems of care in the STPs and the ICS sort of model. This is what we're seeing in Greater Manchester as we look with the local health and care record exemplar bids, is that there's a move to sharing data and information of much wider parts of the health system. But what's going to be really important within that is that that data has the appropriate granularity and the appropriate authority in terms of we know where that data's come from and it's trusted. And again, a standardized record format will allow that data to be captured and used many times. We need to bridge across the various silos of information, the data repositories, so information standards allow us to do that and have use of the data for secondary care purposes. And as already alluded to, the use of standardized records, as with AID in Southampton, allows open platforms, the use of apps, wearables, and co-production of healthcare data by the citizen. Okay, so I've told you a little bit about the role of the PRSB, their stakeholder groups, their members, the vision for the PRSB, which is to develop safe, standardized records to support reliable care. And I've also alluded to two areas, transfers of care and the integrated care record, where the PRSB are contributing to the development of reliable, replicable care. And finally, I've just finished with a summary of the vision for the future, if you like, around organizational systems, big data, and co-production of information, which the PRSB will be supporting via standardized collection. So apologies for this slight technical failure. That video is on the internet, on the PRSB site. I would recommend that you spend a bit of time looking at it because it really does bring this to life. And myself and Helena are happy to take any questions. Thank you. Yeah, Anna.
Are there any groups of clinicians or any part of any sector of the healthcare economy that have been particularly difficult to engage with or difficult to get them to use the PRSB standards for their ongoing care?
So, Helene may have more insight, but to the best of my knowledge, there's been great engagement from the professional bodies and from the organisation to support this. Helene, is there any particular areas where we've struggled?
So I think one of the challenges is around the professional bodies are very supportive, but I think it's about getting the message out to frontline clinicians and professionals, and also getting patients more involved. And the more input we have, the stronger the standards are going to be, and the more they will capture what people think is essential information to share. Yeah.
So I think the implementation phase, Anna, is actually really important. Once we've got the standard developed, is actually how then do we, for example, via the Allscripts record, how do we replicate these in that record to make them usable and almost indiscernible as part of routine care. So that, as Helene said, that's the challenge. Rather than at a professional group level, it's the implementation and translation into practice.
Are you able to measure that?
In terms of the difficulties.
In terms of how the PRSB standards are adopted throughout the care community, is there a way you can, in the future, measure which parts of the care community are
Yeah, well, absolutely. I
practical?
mean, I think that the first thing to do is think about, well, sort of map onto the care pathway what has been done. There is a slide of that, but didn't show in terms of start to finish pathway where those opportunities are. So the first thing is to do that, and then the second thing is to ensure there's adoption and take up in those appropriate areas. Absolutely. Good. Okay, well, thank you for your time. Please do have a look at the PRSB website, have a look at the video, and if there are any burning questions or desire to contribute to these, then please get in touch with either myself or Helene, and we will recruit you into our ever-growing body of advisors and professional contributors. Thank you.